Welcome to the Psychology Talk podcast. We are your hosts, Dr. Scott Hoye, clinical psychologist,
and Kyle Miller, licensed counselor. Psychology Talk is a unique conversation about psychology around the globe. We speak with psychology experts to keep you informed about current issues and trends. We advocate toward reducing stigma and educate about mental health.
While you're listening, please take a moment to give us a review and subscribe on Apple Podcasts, Spreaker, or your favorite streaming service. It helps us to continue providing you with quality programming. And now, enjoy the episode. Well, hello and welcome to the Psychology Talk podcast. I'm Dr. Scott Hoye. Today my guest is Thad Cummings. Thad is an emergency department nurse as well as the author of Running from Fear and Radical Compassion. After spending a decade running social enterprises and a nonprofit, he founded Changing Company, where he shares his passion for bringing new conversations to the landscape and where all voices can be heard, barriers are broken, and the polarization of our community is diminished. Thad will be discussing the confluence of his work on mental health, speaking workshops, and how that has evolved to try and meet the levels of burnout and despair he has found working these past 2 years in an ICU and ER environment amongst the COVID pandemic. Well, welcome to the show.
Thanks for having me, Scott.
Yeah. Well, maybe you can give a little bit about your background. I know previously, before we started the recording, we were talking a little bit about where you come from. But where are you now, and how does where you come from kind of lead up to where you are right now?
You know, the reality of what I have found in the work that I experience today is this amalgamation of just pain and fear. And it's been what I believe is the driving force behind the polarization, the politics, all the way into what we see in an everyday reality, say just working in an emergency room, right? Where not only am I talking about literal pain, but the pain and the fear of all that life brings with it when things go wrong, right? We tend to really distract ourselves from a lot of that pain and fear, and then the gift that I get to see and be a part of in these very difficult environments is when all those curtains are pulled back, when all the shrouds are gone, and that pain and fear is brought forefront. And so my story really comes back with and wrestling with that pain and fear from my childhood, that very pain that drove me to try to save the world and start companies and start nonprofits to keep others from experiencing that same pain and fear that I was going through. And I did the same thing in reverse, all the way to working until, the 100-hour work weeks and trying to build this empire of self-worth, and then getting sick and everything collapsing and kind of losing it all in the span of a few months. And so the joke I always get to make is that I got to have my midlife crisis young, and okay. to go from nothing to that 7-figure worth back to nothing, and just trying to survive and just trying to keep my health open so that my daughter will have a father in her future, when I know what it was like to even lose, my father growing up as a child. So it's been a really difficult journey to get to this point. But what I can simply say is, in the work that I was able to do, having everything taken away from me, having all those safety nets and all those false beliefs of control and worth and value stripped away from me when I was, naked and bare against the world, was wrestling with these concepts of just something as simple as hurt people, right, Scott? Like, nobody comes into this world trying to destroy somebody else's day. We are reacting out of the pain that is within us. And when I got involved in writing books and speaking. It came away from this version of Thad, who was the CEO, the head of the nonprofit, who was out there making, had his poop in a group and was crushing it by the, as we define it, by the American dream.
Okay, well, tell me, what is this nonprofit that you ran, this past one?
So all my businesses were social enterprises, and by that I just mean they all had an end goal. So, for example, one of the businesses did sustainability, zero waste type work, right? And so that was tied into donation programs with different nonprofits. One of them was 20 Liters, which builds water filtration systems in Rwanda, right? And so it was trying to use products that were not only making an impact already, but then having these secondary impacts and trying to build this bigger story. And so part of the way I did that was then also funding profits into a nonprofit to do not just international work, but then local work within my community. So we did education systems and so simple things of like community gardens and working in school systems and stuff and trying to help kids and food deserts and things like that. Mm-hmm. Needs that every one of us has that can actually bring us together.
Mm-hmm. Okay. And so you were working on that, and then at some point you decided to move into the medical field. And currently you're working on, is it correct? You're working on a nurse practitioner degree, and you're talking about these pain points. How are these pain points connected to the current pain point? And we kind of connect those together, because what you're talking about is loss and coming back from, if you will, a phoenix kind of image. You're coming back from a lot of loss and having to learn that it's okay to have loss. You're still here. You're still going to continue to, who you are isn't what you own or what you have around you, or the circumstances you assume will always be the same. But rather, that can ebb and flow and fluctuate. But the core person is still, if you were, your soul is still there, right?
Absolutely. I think to add to what you're saying right there is the soul was always there. It was pulling away the layers that were keeping me from seeing it. So that is the businesses, the nonprofits, the pain that was encapsulating me, that was keeping me from even seeing myself, right? So it took getting sick and having everything implode and crash and losing everything all in a very short amount of time, because that's how stubborn I am, if I'm going to be honest. It took all of that to happen and at once for me to then face the inner pains and realities that were actually driving me, that were controlling me, that fear and that pain. And it was in that journey, in therapy, going to the retreats, reading the books, doing the work, doing all that very hard intentional work, which took a long time. I wish, everyone wants to say, give me the pill, it'll be fixed in a week. No, that was months to years. And that's a journey that I'm still actively on. But it was what I learned in there that allowed me to start re-engaging the world from a different way and a different belief systems of values and worth. And that's what's calmed down a lot of my fears to wrestle with pain in a whole new way.
Well, how is this working out? Like you said, you're in, I know people who work in EDs and ERs and whatnot during COVID. And no matter if you're working in it can be maybe worse working in a small town or a smaller hospital rather than a large, university or a large city hospital. I think the pain can be just as bad as the ICU units expand, take over the units and whatnot. But how are you helping people deal with burnout? Because I know so many people working in the medical field are doing just that. They're burning out and they're having a really hard time coping. What's going on there?
Bluntly speaking, I stumbled into the medical field when I decided to change careers. And I graduated with my nursing license 2 weeks before the hospital that I started was shut down from COVID. And so, yes, I worked as a nurse tech in this season of the years that come after, say, the post-collapse, right? When the businesses and everything implode and I had to, find out a career or job or something. This is when I went back to the hospital, started working in inpatient oncology and hospice and wrestling with all these questions, right? What is the meaning of life? Why are we here, right? And sitting in those really hard places. is actually very relaxing and rewarding and giving to me, because it's what I call the BS free zone, right? Because when you're sitting with people who are dying, and you have a 36-year-old mother of 3, right? And there's nothing left. Everything is stripped bare. And those are real and honest questions. And all these patients and mentors and people so wise that taught me along that healing journey is what kind of continued this transition to where by time that I actually go from a nurse tech, go back and get another degree at school and graduate and come into the hospital system as a nurse, COVID hits and the medical system implodes. And it's still imploding to this day. I can honestly say it's worse today than it was a year ago when we didn't think it could get any worse. And what I see is not only just the pain of the patients and the death and the trauma and the loss. It's also come into the staff, the culture, the community, this loss of hope, this loss of, this just what is the point in this never ending pandemic that we can't even get out of, and the burnout and the stress of my colleagues. It's just, how do we start having these really hard conversations? These are conversations that I've had with my bosses and managers of different hospitals, and started doing workshops and holding these group gatherings, because as a society, we do a really poor job of creating safe places to have these conversations, and we avoid it. Or the reality is, you can go through the statistics of, say, if you work in an ER and ICU, what's your likelihood of becoming an alcoholic, right? And the rates of physician alcoholics in the ER from just seeing this level of trauma and pain and burnout every day, right? What do we do with that? Because the reality of what I see in this environment is a lot of people close down, they wall off, they shut down, they become abrasive, right, as these protection mechanisms to grapple with this level of pain on top of the pain we're all facing. And so I think my hope here in this work is, how do we not only just create safe spaces, but create an opener dialogue for our culture to engage this, because that is the end result for all of us. None of us are getting out of here alive. And what are we doing to talk about these things and these pain that we're carrying that are actually keeping us from living today here in the present?
Mm-hmm. Well, how are you facilitating? You said you're trying to facilitate this conversation with groups in the hospital that you're currently working in, or in several different hospitals. How is that? What's that look like?
So one example is when I take people, say, through a workshop, and my blunt, honest answer is there's nothing special about me. Typically, the groups unfold. I only simply facilitate and start a discussion that involves that's naturally already there, that people are already wanting to have. And so whether I get different departments together, or whether I take just a internal group that are within the same department, because you almost become like family, right? When you work in that type of environment day in and day out, the bonds, you may have nothing in common with this person, never see him outside of work, but you still feel like family when you come to work, because when you're doing CPR on somebody, it's that mentality of the trench warfare, right? That bonds you together. Getting people into the room can be the difficult part, but once people are there, all it takes is a few simple questions and some challenges and some vulnerability to open up to the pain that people want to share and discuss, that it almost naturally comes pouring out. And the conversations then evolve towards the end of the workshop is, now what can we do with this? So that way that's not just left here in this one time, this 1 3-hour workshop or what have you, right?
Mm-hmm. Okay. And how does that usually roll out? How does it unfold?
The goal ultimately is is creating a culture of vulnerability. And I want to be careful how I say this, creating a culture of vulnerability that allows those conversations to be safely heard and had between all members of the hospital outside of that room, between management, all that, because in shifting that culture is what allows people to not only just take these resources that we're talking about, right, but bring it back in to share with each other. So that way the vulnerable the vulnerability doesn't become there's something wrong with me, this shame and guilt, right? It's we are all in this poop show together, and therefore we can all relate to one another, and therefore we can all help and support each other, right? And this is where the shift comes from this walled off, individualistic American culture type person stuck in a very difficult situation to a beautiful flourishing of where people actually really connect on a much safer and deeper level. And that to me is the psychology behind how you can sustain living in that level, that difficult of an environment for that many, for years on end without having your typical 3-month, 6-month, 9-month burnout rates, or what COVID, has just destroyed our hospital staff, and what's left of it is just, it's the clinging on by the fingertips.
Mm-hmm. Okay. Let's just walk back a little bit here. Many people don't understand, or they might have an intellectual understanding and some empathy, but they might not have an actual experiential empathy of what's going on in hospital systems right now. Mm-hmm. I know that people might be tired of hearing this, but I don't think that people get it. Maybe you can describe what it is like working in your particular hospital and what's going on.
I actually I just did an interview with Business Insider trying to do just that, to just share a glimpse behind the curtain, because I came out of a particularly difficult day in the ICU last year and watched many people die that day, mm-hmm. young people, parents. And I met a friend that next morning to go for a walk and get a cup of coffee just to process. And I walked into this coffee shop and I didn't realize, it had been a regular. I hadn't been anywhere in public in months. And so I didn't know this was all going on, but it was COVID's a hoax. No one wanted to wear masks. This was at the peak of our ICU death rates last year. And they had been holding these rallies for anti-COVID type. And I walked in the door and I saw this, about 120 people in a crammed in space and all this. And my blood began to boil and I became so infuriated, and my friend had to calm me down, get me to breathe. And she ended up saying to me, have compassion, Thad, because these people don't know what you know. They don't see what you see, right? And so no different than that conversation that I'm having with my colleagues in a workshop about engaging in perspective and compassion and empathy. It's the same conversation I have to have with myself on a regular basis, because I get there's a lot of politics and there's a lot of rhetoric, and I get people are burned out as well and don't care and are tired and want to move on with their lives. And the hard reality is to balance that with, when I go somewhere, people are like, why are you still wearing a mask? And it's hard not to when you watch so many people die constantly, day in and day out, and they didn't have to, right? Because everyone has this image of 90-year-old grandpa who smokes 16 packs of cigarettes a day and drinks, 3/5 of vodka and lives off McDonald's. And that's who dies. It's a different story when it's a 26-year-old kid, right? Mm-hmm. And you're trying to explain to the parents why you just put them to sleep and put a tube down their throat, and that they're never going to wake up again, and you're not going to get to say goodbye to them.
Mm-hmm. Yeah. And that is the reality. Like people are not, it's not just, I just found out about somebody in their 30s recently, semi-connected to me and my wife, who died in the hospital, and had no idea that this was going to happen.
No,
I won't go into the politics of it, but it's really striking what is going on. The fact that the media is not really, it's kind of whitewashing it, right? It's mm-hmm. not really showing it a whole lot. What are the demographics have changed, right? From the mm-hmm. first people. So it's like people from all walks of life. Are they primarily unvaccinated or don't have a resistance to the virus right now?
It's a question I get asked a lot. And I always say stick with the research because my evidence is anecdotal. But what I will say from what I've studied and what I've learned and what I've seen, and the 3 hospitals that I work with, we had a wave come through in the very beginning that we didn't understand, and a lot of people got sick, right? When Delta came out, that was post-vaccine, and bluntly speaking, 99.9% really, it was very rare that we saw anybody who got sick who was not vaccinated, right? So just about everyone who died was unvaccinated. That was just the honest reality. I didn't personally experience even intubating somebody who was vaccinated. Not that it doesn't happen. There's always exceptions, right? The Omicron, what's been difficult and changed is, while it is, yes, a milder variant, the sheer numbers, because it can get around initial vaccines, what ends up happening is, if you're vaccinated, you're like, I'm free, I don't need a mask, I'm good to go. If you're unvaccinated, you weren't going to wear a mask in the first place. And so we keep this virus and allow it to keep mutating and in circulation. And now it's hitting us with such volume that, yes, the death rate might be lower, but the volume is so much higher that the death rates are still creeping back up. I think we're averaging, 1,500, 2,000 cases of, deaths a day in the United States, right? Which the worst we ever got to was somewhere around 3,000, and we're on this back uphill trajectory. And it's just,
well, yeah, it's the volume. So the percentages of people is different based on the volume of cases. Mm-hmm. The deaths percentage is different, but the numbers are higher.
But the numbers are going back up, right, because and that's the blunt reality. And I feel relatively confident saying that typically those who are vaccinated do still fare better, right, with the new variant. That's absolutely true. It's also, I can also say that I do take care of vaccinated people who can get really sick. And it's hard. The politics and all that gets lost on me on both sides. And I want people to keep living and moving forward their lives. I don't, I get unbiased because, when I'm in work, I've got to wear an N95 for 14, 15 straight hours. I got to wear a mask on top of that. I might have to wear face shields and goggles and plastic bags and all these lever. And it's like, so when people say that I can't wear a cloth mask, well, I'm like, well, have you ever been on BiPAP? Because let me tell you, that's pretty hard to breathe on, and it just doesn't have to be this way. I think that's the hardest part, was if people still on both sides just took it seriously enough to do even something as simple as wearing masks when they gathered in public. I honestly believe we could have wiped this thing out when it started, but we have polarized it, not just in the United States, but globally so much to where my frustration comes from 2 things. One, not only have we lost our shared humanity for each other, but the second thing that people don't realize, I don't care what you believe about it. When our hospitals are overflowing like this, when you get a heart attack, when you get into a car accident, when you get a stroke, whatever happens, you still want to come to the hospital, and we don't have beds for you. I've had patients stuck in the ER for 8 days who had a heart attack, and we had nowhere to send them to get it fixed. Right? That is the secondary repercussions that people don't even understand that are behind this. And so you want to say it's your choice and your belief, but we all are impacting each other. And that's what's so hard about this, that I don't think the bigger picture is grasping.
The 2 analogies that I've come up with is, if there's an avalanche and you're standing underneath of it, you grab other people to get them out of the way if they will come with you, and you don't stand there negotiating with it. The other people I know working in EDs and in the medical field, it's kind of like, at times you're being told by the whole system, no blame on anyone, but it's just everything is being so impacted right now. It's like trying to hold back, as a medical professional, trying to hold back a tsunami with your bare hands and told, just keep pushing. It'll eventually go away. And it seemed, and people have nodded their head and says, yes, that's exactly what it
Absolutely.
is, Doc. Yeah, that's, and so it feels like that. But there's a sense of, I'm getting a sense that you're really burnt out from it yourself on some level. It's difficult.
Oh, absolutely.
How are you handling this? I mean, you are trying to help people come together to talk about these things. But how are you handling it, like, internally for yourself? What are you doing for self-care? For those who are in the audience who might be able to benefit from some of your insights.
Do you have a good therapist, or do you have people very close with you that you can talk to and process? That's always, I've been very fortunate, right? As a part of my journey, books like The Body Keeps the Score, having these mentors, having spiritual directors, a therapist, my faith, all these things that I've been able to envelop myself in to help me keep my sanity, right? Are very important, and helping people remember to find what works best for them, because a lot of my friends just turn to booze or food or Netflix and try to numb out as best as they can. Mm-hmm. And for me, it's, I have to eat healthy. I have to exercise. I have to go spend time in nature and in solitude and process and see my therapist and go and pray and do all these things, because if I don't, I will not physically be able to show up tomorrow. And I have days when it is really hard to come into the hospital. And I have days that I drive home and I just weep the entire drive home. And that's just the honest reality of it.
I think there's a collective PTSD that medical professionals are experiencing right now. I think intensely. I mean, it's more acute with medical professionals who may or may not understand that they have the symptoms. They might, or they're in denial. And that's the only way they can get through a lot of what you're going through right now.
Absolutely. It's a very, I don't judge or shame anybody. That's a very realistic protection mechanism.
Sometimes it's all you got. I mean, if all you can do is keep pushing against the tsunami to try and hold it back, right? I mean,
and Scott, I'd love to tell you that most days I just let the tsunami take me, and I do what I can to grab a hand along the way. I do have days of weakness and moments where I try to still stand up and turn around and stop it, and realizing how futile that is, and that this isn't going away, and that perhaps, fighting for shared humanity might not happen, but at the very least, I can play my part to have these conversations with folks such as yourself, just to hopefully that some people somewhere might find another narrative or some other form of hope and compassion to keep them going another day, right?
Right. Well, probably a lot of accepting of what you're experiencing, what you're feeling is a huge part of needing what needs to be done, right? Like that first acceptance of the fact that what you're experiencing is not the norm. It may be the norm for a while, hopefully not, but it is not the norm all the time. Let's back up a little bit here and tell me a little bit more about your own initiatives with your company. What's it called and what do you do? I mean, when you're not working on your NP doctorate and working in EDs and trying to help people stop burning out.
Yeah, absolutely. It's called changingcompany.org, just like it sounds. And it evolved because when I was the CEO, when I was consulting for all these major companies in every industry that you can think of, I had this beautiful reality of some days I would be training what you would say the lowest paid scale employees as soon as I leave a meeting from the highest paid scale employees, right? And seeing the disconnect, seeing all this chaos going on, I was able to not only learn from mistakes that I had made in my own businesses and start asking and wrestling with the hardest questions. And where a lot of these workshops and speeches and stuff evolved was just from that experience of trial by fire and learning and error. And so I was able to sit and try and help these companies rebuild and come together and make stronger communities and cultures within their own organizations, right? Stop looking elsewhere, stop doing that and look within. And so it just happened to be a natural fit that by time I come into the hospital, I'm technically, when I came in, I was a nurse tech. That's one of the lowest paid medical professions you can have in the hospital, right? And it's this starting from the ground up. So coming a tech, then a tech becoming a nurse, now a nurse trying to become a provider and working through this ladder from I went from here I am at the top and collapse all the way to the bottom. And now I'm at the bottom trying to, come back up. And so that's been the gift of perspective, is understanding and seeing these bigger pictures that other people are struggling with. Those are what I get to bring in to these workshops when I sit down, and it's a simple format. It's off a lot of the things that I've written about and worked through. But we take 3 hours and we go through these dialogues and we go through these discussions, and I like to hold it loosely because I see where they all have the same general themes, and it doesn't matter if I'm sitting, with the CEO of a manufacturing company or if I'm sitting with another tech from another hospital. The principles always apply the same, right? It still comes back to that. We're all struggling with pain. We're all, fighting our fears, and we all have hopes and desires, and we're all longing for a life of joy. And it's just peeling back the layers and difference and getting that perspective and getting that vulnerability and compassion and empathy back into the equation, so that way we can see each other in our shared humanity to have different conversations. And honestly, I have had people who thoroughly hate each other sit down in these meetings and walk out crying together, right? Mm-hmm. Because the polarization is going on as it's that quote, right? We've forgotten that we belong to one another, right? The Mother Teresa quote. We've forgotten how to see the other person. And so this polarization and the hatred, whatever it is in your life that's driving this, we've forgotten to see one another. And that's the gift of spending time in those vulnerable moments, is allowing people to see each other once more. Is that making any sense?
That does. I also think that it makes people in general, outside of the irritability and the polarization and the politicization of this whole thing, I think in general, the gift of the pandemic perhaps is that we understand that we need to connect to each other's humanity rather than being so isolated like we were beforehand and just didn't see it.
Yeah.
Everything has been magnified about
Absolutely.
our society. All the negatives have been magnified and it might be a gift that we can actually see it to fix it.
I think that says it perfectly, because people go, man, look at what COVID caused. And I said, no, look at what COVID revealed.
Yeah, exactly. Yes. It's revealed a lot.
Because it was already there the whole time.
And the medical system, as you well know, was kind of, thumping along. It wasn't really great to begin with. It's kind of, it needs to be strengthened in some way, shape, or form. And this was not a very good. This is a fine stress test, but it revealed a lot of stressors in the system, right?
Oh yeah,
yeah. Yeah, I think that might be. There's a lot of bonuses coming from this if you can reframe it and look for look for the good in it. It must be very difficult being in the thick of it. And difficult to discern what good can come out of this.
It's
but your perspective is you had everything. You went from nothing, built something up. Went from nothing, went from the ground. You see that this. And the still small voice, so to speak, in the center is the real you. All these other things that you assume are going to be there, or the illusion of permanence, right, is not something that you necessarily cling to. As much
the illusion
as
of permanence and of control, right? That's
right. Yeah.
That's beautifully put. Yeah. Yeah, and I think I got to be honest, Scott. When say a CEO contacts me or anybody, and they want to, it's always, well, what's this going to cost, and how am I going to get my money back out of it? And yeah, sure, I can sit down and I can prove to you, okay, employee retention, yada this, and this is, or say the medical field, they have data out there. It says it costs, depending on which study you look at, if you lose a nurse That's $60,000 to $90,000 that it costs the company by the time you find, retain, train, and right place. So fine. We're going to spend a few $100s here today, and if you save one nurse, that has an ROI of 15 minutes, right? I mean, like, if we're going to be on, if you want me to play financials and numbers, I can prove that. The point that I always try to get to is we're asking the wrong questions when we're looking at it that way, because it's what is the price of your mental health, right? That's the argument, the metaphor when somebody says, if I gave you $1 million, would you let me take your leg? And somebody says no. And they say, well, then you got $1 million leg, right? So it's like, what is your sanity, your joy? What is your value and worth of having a company that's, this idea that interconnected companies and cultures and colleagues, they don't just survive, they start to thrive. What value do you put on having a place where people actually enjoy coming to spend time with one another, right?
Well, I mean, it's kind of like I've done three podcast interviews today, and this seems to be a recurring theme for me. Nothing against shareholders, but the shareholders class, if they're running everything, then you don't have companies looking out for their employees, and they don't mind the idea of offshoring stuff. And just if it's all for bottom line thinking, eventually the bottom line thinking universally applied will destroy democracy. It'll destroy systems. It'll destroy businesses themselves, because it's not about creating community, which is which is really what is of more value to you really than community, the quality of your community ultimately. Yeah. And it's just extremely damaging. It forces everybody to have to try to act like they're an individual rather than coming together. And it adds to the polarization. And
to your point, even so, say these folks
it's also bad for capitalism.
Oh yeah. Well, and what I've noticed is, even if you have, say, whatever level people are on, say, this tier or corporate ladder, whatever you want to call it, one of the beautiful gifts of not just being that, previous CEO or whatever, but all the people that I know that are CEOs that may be worth 10 million, 100 million, whatever their worth and value is. I know 2 CEOs personally out of dozens that are not popping some form of antidepressant or Xanax or something to get through the day.
Yes, and that's telling you that they're not happy, they're not living fulfilling lives, and they have maybe transient, hopefully for them, symptomology that is not really being treated. If you're just popping a pill for it, you're trying to get rid of the symptoms, so you can be in more denial and continue along what you're doing.
Well, and that's the reality of when I sit with staff and they want to point the finger and blame upper management, or upper management wants to point and blame, and I say, well, how do we stop this, right? How do we start looking inward? So when that's to me the humanity component of it. And when you have, I've been in workshops where I've had, the leader of a very large organization acknowledge in front of people in a very vulnerable way that I'm struggling with depression. My wife has cancer, right? And our marriage is really rough, right? And all of a sudden, this person who was now just, he's just a jerk who sits in the, the fancy office up there and he doesn't give a crap about me. And all of a sudden, that person over in this department just saw the shared humanity of it, of what I had no idea, right? Because it's really hard. This is my friend Irene Butters said, it's really hard to hate your enemies close up.
Yeah, that's a good way to put it. Yeah.
Right.
Yeah. Well, going forward, what are some ways do you think people can actually do the work, and how can they reach out to you to work on this stuff?
Well, the first thing I always tell people is plan for significantly more time than you ever thought it was going to take. because I don't think that's the honest conversation that we have in a culture that is so addicted to, I have a headache, give me aspirin, give me ibuprofen, right? Give me Tylenol, just give me a pill to fix it. Not realizing that the headache is the warning sign our body is giving us to say, hey, something is wrong, stop, slow down, right? And this process takes a long time. And I say that to keep people from getting discouraged. When they hit their New Year's resolution, they go through a 1-week diet and they quit and walk out. These are lifestyle changes that we're talking about here, right? This is deep inner work. And folks, when they're just on their personal journey, yes, people reach out and they want me to come speak or do workshops and all. That's fine. That's the changingcompany.org. They can reach out and connect to me through social media. It's just my name, Thad Cummings. And I'm always happy. I love it. It's one of the best things I get to do is come and sit with people and organizations and wrestle through that. On the personal level, when people just ask me, they're not trying to change the culture of their business environment or their family. It's just say, find the resources that work for you, right? And make that list. I always tell people there's 4 things you have to do when they come into the ER, right? Because I get to have this interaction with people where it's like, this is the only time I have to educate you before you're on a trajectory that's going to lead you into foot amputations from diabetes, or you're going to have a heart attack from stuff, right? This is my brief. And it's just from the science and all the books and everything that I've read that people have passed on to me. First one is, you have to eat healthy, which no one wants to hear in America because McDonald's tastes great, right? You have to give your body the physical nutrition that it needs. Sleep, like books like Why We Sleep was a beautiful resources. Everyone has to sleep 8 hours uninterrupted a night. Otherwise your brain can't function, right? Stress, you gotta cut the stress out, right? And it's so ironic to say that because bills don't just go away because you say, oh, I'm not going to have stress anymore, right? But we have to. And then that last one is not only just for the accountability, but what resources and what people and access to what things do you have in your life that will help you? Is that therapy? Is that your religion? Is that a mentor, spiritual guide, counselor? Who can sit with you in these difficult places and wrestle with these hard questions? Because I'm telling you, everyone thinks that they're the only person in the world I've met that's going through this. And I get to tell everyone, no, you're not, right? We're all going through this and white knuckling it together. And once we can realize that and come together in that shared humanity and realize you're not alone and start normalizing and getting away from some of these stigmas, that's where I think a lot of beautiful growth really happens.
Okay. All right. And they can reach you at where again?
changingcompany.org.
changingcompany.org. And you have some books available as well, right?
Yep. Yeah. I made, they should be all free through the website. I did that once COVID hit, kind of one of those, if it can be a resource, I'm not trying to make money off that, of trying to help. So, they can find those, on the website. If they have any issues, they can reach out through the link there. Like I said, I'm not huge into social media, but people can also find me there, on Facebook or Instagram. And so I typically have kind of a quick one-pager of things that I found that helped me, that are just suggestions to get people started, that I often send to people, of a few books to read, maybe a few documentaries to watch or things like that, to just start opening those conversations. Yeah.
Okay. Well, Mr. Cummings, thank you so much for coming on the Psychology Talk podcast. Take care. Be well. Be well. Be safe. Be well. And make sure you get some rest. Thank you for listening to the Psychology Talk podcast. This podcast is intended for informative and entertainment purposes only. If you need a mental health professional, please seek one out. All material, copyright, the Psychology Talk podcast. Music is provided by the oddly Italianate named band Serenati. Ciao.